Julie Thompson, Fenway Health. Thank you so much for coming in to discuss all of the great things happening at Fenway Health right now.
Thank you for having me.
Awesome.
It's a pleasure.
Awesome. So can you tell us, start off by what is Fenway Health and what is your mission?
Yeah, so Fenway Health is a large community health center. We're located right in the Fenway neighborhood. Our mission is really to provide accessible healthcare, equitable healthcare, and high quality healthcare to the population within our neighborhood, but we specifically center LGBTQIA+ individuals, BIPOC individuals, and other marginalized communities. So we serve about 35,000 patients. We have about 40 medical providers, but we also have other services like integrated behavioral health care. We have what's called an MAT, or a medicated assisted treatment program for folks with substance use disorder. Mm-hmm. We have eye care, dental, our own pharmacy, and a lab. So it's a pretty comprehensive health center.
Absolutely, and being specific for not necessarily always for LGBTQ people, but having that highlight and having those programs is pretty unique. What sets Fenway Health apart from other health institutes?
Yeah, so one of the things I'm extremely passionate about at Fenway is what we call an integrated model of primary care, meaning that we provide LGBT health services, transgender health services, services for folks living with HIV directly within primary care. Mm-hmm. And so all of our providers are competent and confident in providing those services. So like you said, we serve everyone in the community, but ensuring that all of our providers have the education, have the ability to make sure that we're centering care specifically to our patients' needs is really huge. And by providing that care within primary care, it's increasing access. So all of our providers do this care, and it also decreases stigma, right? That we see folks, regardless of their identity, regardless of the medical issues they have, and we do that all, again, all within primary care services. Everyone's sitting in the same waiting room. They can get services, anytime we're open. And so I think that's really what sets Fenway apart.
Well, what a unique opportunity for all of these LGBTQ people in our community in Boston to have that safe place to go, right? So you talked a little bit about the programs and resources you have at Fenway Health. Can you speak a little bit more to that?
Sure. Yeah. So we provide all sorts of services at Fenway, including primary care and behavioral health care. Again, within primary care, we do transgender health. We see all ages. So we see young folks. So we do family medicine up through all ages. And the resources we have provider-facing resources specific to our population. So gender affirming care resources that other health centers may not have. We're happy to offer those as either training or material resources to other providers. And we have lots of patient-facing educational resources that are, again, really unique to our patient population. So, talking about things like cancer prevention or medication options or even legal resources for our specific patients, so that folks really have a place they can go that sees them and their unique needs.
Yes, and having a place that sees you and your unique needs is not necessarily accessible to everyone. So it's great to have that in a central area in Boston. So we know that there are a lot of health disparities with the LGBTQ community. Can you speak to what contributes to that,
Sure.
especially the trans community?
Yeah, so exactly right. So the LGBT community has significant health disparities compared to the general population, and most of these are due to discrimination and stigma. There is actually this survey, it's called the 2022 US Trans Survey, and it was one of the largest surveys done with trans and gender diverse individuals. And there were over 90,000 trans folks who participated in this survey. And when asked about experiences accessing healthcare, 48%, so half of this 92,000 people reported that they had, in the past year, had at least one negative experience in healthcare specific to their trans identity. A quarter of folks, 24% of folks, actually reported that they didn't seek the healthcare they needed because of fear of discrimination. And so we also know that decreased access to healthcare leads to poorer health outcomes. And so if folks are experiencing having negative experiences in healthcare and are not going to healthcare for fear, we know that that's going to lead to more and more health disparities. And Obviously that's when someone has a negative experience, that's going to affect them personally, but it also it has a larger effect on the community and a longer lasting effect on the community. If you see a number of your peers within your peer group continuously having a negative experience within a system like the medical system, it makes you more leery of that system,
more
right?
Resistant.
Exactly,
yeah.
Right? That you're not going to have as much trust in that system. You're going to think twice about going into healthcare to get your blood pressure checked because it's a scary experience if you know someone that you connect with that's had a negative experience. And so we see that within the trans population, the trans community, that when folks have that negative experience, it decreases that trust. And so creating a health center, having places where people can go that feels safe and welcoming and hopefully sees the people who are coming into the health center, is hoping to decrease some of those health disparities, having more positive experiences, and not just one, but hopefully multiple positive experiences to start to build that trust back up.
Yeah, and building that trust is not super easy to do with a healthcare system like we have here. So extremely important to have those very careful providers. So how can we better support our LGBTQ community? How can we stand in solidarity and better advocate for those who need advocating?
Yeah, I think, right now, I think it's continuing to do this work, continuing to provide gender affirming care, making sure that folks are advocating for it within their health centers. I mean, I feel very fortunate at Fenway Health that we have great leadership who's very dedicated to our mission and continuing the work that we do. And other providers also need that support as well to do their work. It's not just Fenway who does this work, but there's other great health centers in Boston too who are providing gender affirming care. So continuing to support folks. That also means talking to our legislators, our government, to make sure that we're strengthening protections for providers, with our SHIELD law. I think on the other side, right, it's also we need to have trans and gender diverse and LGBT voices and really understand what the community needs, right? So we want to make sure that we're bringing those voices up, we're listening to what the community needs, that we're standing in, showing up. I think if we are in places of privilege, if we are in places of power, we need to use that, and whether that's in the company that we work at, whether it's in our healthcare system on a local level or national level, that's an opportunity that right now we really need to take.
Absolutely, and now more than ever, right? So where can viewers learn more about Fenway Health and all of the fantastic programs that you guys have?
You could go to our website, fenwayhealth.org. You can also show up at Fenway. We're a health center right on Boylston Street in the Fenway, the big glass building. You're welcome to come in, take a look around, see if it feels like a nice, inviting place. We have lots of resources on our website at fenwayhealth.org that anyone can access. You don't have to be a patient at Fenway to check out all of the different services and, again, access the resources.
Awesome. Well, thank you so much for joining us today, Julie.
Thank you.